If you're really short, a doctor can make a small incision into your thigh and carefully break your femur in half. Then the ends of the broken bone are gradually and slowly separated, at which point a rod is inserted to hold the bones in position. This stimulates the body to grow new bone in the gap, inching you up over time. Soft tissues like muscles and nerves also grow to accommodate the increased length. Once everything has hardened and strengthened, you'll be a taller version of your old self.
This is actually interesting. People think this is brand new, but this has been around since the 90s. And even before that, probably the 80s and even 70s. A guy named Elizarov, who was in Russia, was doing this and was making what we call an osteotomy. Cut the bone in half and then slowly stretch it. New bone will form in between. It's really a great procedure, but you really have, it's very expensive, number one. It can be good for limb differences, but it's been now for the last maybe 15, 20 years being used just to increase your height. A lot of patients are really, really happy with it. They're happy seeing the advantages they can have to be a taller person. They feel better about themselves, but it does come at a cost. First, it's a little bit expensive. It's a very long, painful procedure, and you may have to use crutches for a while. You may have to use a walker for a while, and kind of learn how to walk in a special way. So there are other ways, other things that you have to keep in mind for it. But I've met a lot of patients that are really happy with it, and if you're interested in being a taller guy, then you should check it out. This is Dr. Steinberg for Alpha Male Plastic Surgery. Thanks.